Good morning to one and all present here. Today, we are going to study about obstructive jaundice, the modern method of diagnosis and its treatment. So, what is jaundice? A syndrome characterized by hysteric staining of the skin, mucous membrane, and sclera due to increase the accumulation of bile in the serum and other body fluids as well as tissues, depending on the localization of primary pathological process leading to the development of the jaundice and the mechanism of occurrence following the types of jaundice are distinguished. So, what are the classification of jaundice? That is suprahepatic or hemolytic jaundice we can say. They are caused mainly due to increase in production of Br, mainly in connection with increased decay of red blood cells and less often with impaired plasma transport of Br. Hemolytic jaundice is congenital as well as associated with autoimmune or B12 deficiency anemia, that is also known as folic deficiency anemia, as well as various kind of intoxications. Then hepatic or parenchymal jaundice, that is due to impaired of capture conjugations and excretion of Br by hepatocyte due to the damage during various pathological process as well as acquired and hereditary defect in the structure of hepatocytes and enzyme involved in metabolism and transport of Br into the cell. Parenchymal jaundice is caused by acute or chronic hepatitis or hepatocyst drug and toxic hepatitis. Then comes the mechanical or obstructive jaundice. It is complication of pathological process that violate the outflow of bile at various level of bile duct. This is the bilirubin exchange. Here you can see the liver which carries the common here the bile duct where it takes the bile to the obstruction, that is the exchange takes place and the flow is donated by the arrow mark. Then comes anatomy of the biliary tract. Here the brown color is known as the liver, you can see here, and the green color, that is gallbladder. Here comes the common bile duct. Here then the major duodenal papillae where the bile duct is drawn inside the duodenum. Then, what is the etiology? Obstructive jaundice is caused by violation of outflow of bile from the liver to the duodenum. Throughout the path of bile outflow, an obstruction may occur due to obstruction from the inside or compression from the outside. The most common cause of obstructive jaundice are the stone in bile duct, mostly in 50% of cases, or neoplasm in 40% of cases in the duct. Large duodenal nipple, pancreas and gallbladder. The mechanical jaundice can also be caused by other causes, that is 10% of cases. Then comes stenosis of the BDS, duct obstructions, atresia of biliary tract and cholangitis, pancreatitis and liver tumors. First one is malformation, that is atresia of the bile duct, hypoplasia of bile duct, cholandocyst, then duodenal diverticula located near the BDS. Then comes benign biliary tract disease, that is cholelithiasis, complicated by cholelithiasis. Then comes large duodenal papilla, impacted stone, inflammatory structures of the bile duct, acute papillitis, stenosis of large duodenal papilla. Third comes the inflammatory disease, that is acute cholecystitis, cholangitis, pancreatitis, alveolar in echocolysis in the area of liver gate. Then comes benign biliary tract disease, that is cholelithiasis, complicated by cholelithiasis, large duodenal papilla, impacted stone, inflammatory structure of bile duct, acute papillitis, stenosis of large duodenal papilla. Then third comes the inflammatory disease, that is acute cholecystitis, cholangitis, pancreatitis, then alveolar endocholiasis in the area